Dear site staff, a big thank you for all your hard work and your ongoing efforts. This video will help you to understand what to expect when the trial is ready to be completed. It is important to understand and communicate we don't know when the trial will complete, as it is an outcome trial. The purpose of this film is to refresh your memory regarding the trial completion process, so you are ready when we achieve the protocol-defined number of events or the decision is made to complete the trial after an interim analysis. Please be aware that minor trial-specific differences may occur. Remember to always consult the protocol. Trial completion refers to the phase when the decision is made to stop the trial until last patient, last visit. This includes end-of-treatment visits as well as the follow-up visit. It is important to understand that there are two trial completion scenarios: regular and interim completion. In a regular trial completion scenario, there will be a planning period of 8 weeks prior to the trial stop date. Subjects will continue with their regularly scheduled appointments during this time. At the end of 8 weeks, all visits will become end of treatment and follow-up. This planning period is where you should make sure you have scheduled the end of treatment and follow-up visits for your patients. It is also an opportunity to prepare your patients for finalization of the trial and begin discussions with them about post-trial treatments if relevant. After the trial stop date, all end-of-treatment visits must be conducted within 6 weeks. The follow-up visit should happen 5 weeks after the end-of-treatment visit. There is a plus or minus 7 days visit window to conduct the follow-up visit, and once all of these are completed, we will reach last patient, last visit. After 4 to 5 weeks, all the data queries need to be resolved, and then the database will be locked. Key results will become available shortly after. To make sure both visits are completed within 12 weeks after the trial stop date, we encourage you to plan all visits as soon as possible once the trial stop date is announced. Once the date of the study stop is reached, you should execute the visits as soon as possible. Just remember that there must be a minimum of 5 weeks from end of treatment visit to the follow-up visit, and a maximum of 6 weeks. In an optimal case, the end-of-treatment visit and follow-up visit are conducted close to the trial stop date. In case of an interim completion scenario, there will be no dedicated planning period. Therefore, please schedule your visits as soon as possible. In this scenario, trial completion is triggered by data from an interim analysis. In the case of an interim completion, the end-of-treatment period will start immediately after the trial stop date announcement. The end-of-treatment visit needs to be completed within 6 weeks of this announcement. The rest of the timeline is identical to the regular trial completion scenario. Since you will not have 8 weeks' time to schedule your patient's visits in the interim scenario, please take time to be prepared and have a plan in order to ensure a timely completion when this announcement is made. In an interim completion scenario, we will start directly with the 12 weeks window. It is acceptable to have the visits conducted within the entire 12 weeks. Just remember that there must be a minimum of 5 weeks from the end of treatment visit to the follow-up visit, and a maximum of 6 weeks. In an optimal case, the end of treatment visit and follow-up visit are conducted as close to the trial stop date as possible. Novo Nordisk will provide you with support and guidance, but you should also start planning early to ensure everything is set up in the event of an interim completion. Therefore, please always be on track with your EDC data entry and event reporting. We have created a trial completion package for you to facilitate timely trial completion. You can find this package on the Connect platform. With the mandatory electronic planning tool, Novo Complete, you have an easy overview when you schedule your patient's end of treatment and follow-up visits. Novo Complete is a new planning tool to support keeping an overview of your planned visits to support ensuring the timelines. We hope that this video helped you gain an overview and created awareness about the trial completion process. Please be informed that this video is for your training only. Thank you for watching.